Hello and welcome to DeltaCast Tutorials. My name is Lindsey, and today I'll be demonstrating a short leg posterior splint with a medial lateral stirrup using plaster. So for this splint, the indications are concentrated all in the ankle area: Achilles, tarsals, metatarsal joints, phalanges, and calcaneal fractures. So it's going to be sensitive in all these areas. Also, for other sensitive areas, we have to be conscious that the splint doesn't squeeze the sides of the foot, like the first and fifth metatarsal joint. The splint proximal dimensions should not dig into the back of the leg or hamstring for good range of motion. Lastly, the splint should either support all the toes or not at all, meaning it should only be a quarter inch in length beyond the toes to avoid causing the patient to trip while on crutches during swing through, or not at all to allow the toes to totally move freely. The size needed for most patients are 4 and 5 inches to envelop or support the foot better. The stirrup size should not be so wide that it allows the splint to totally encompass the lower leg during the inflammation stage of healing. Stockinette is not always needed. Be mindful of wounds that might need to be addressed first, but it does keep the padding from being so itchy, and it keeps the integrity of the splint. So roll it up, but put it on carefully to not cause so much discomfort to the patient. You can grab the foot to stabilize the extremity as you apply the stockinette. Avoid excess wrinkled stockinette by removing or cutting to smooth out. Using the widest padding size possible to quickly cover the extremity. Ensure you have at least 2 to 4 layers of adequate padding or more, depending on physician directed, such as a Robert Jones compression dressing splint. Be conscious of the bony prominences that may need more padding. Use a figure 8 going around the ankle to ensure adequate coverage. Avoid wrinkles as much as possible. Stabilize the leg as you pull off padding to ensure you do not jerk the patient's leg around. Continue down the extremity, ensuring the heel has adequate coverage. As you move more proximal with your padding, use the 50-50 coverage technique. Every revolution around should cover 50% of what you just put on. And then palpate over the bony prominences to ensure proper coverage. I'm using specialist padding that's micropleated and has more loft to provide more comfort. Again, palpate over the malleoli and heel for adequate coverage. Now measure for the length of our posterior splint using the unaffected side. I'll be using 12 layers in thickness for the posterior slab and 5 layers for the stirrup slab. Don gloves if desired to avoid caking of the plaster on your fingers. Ensure the water is room temperature or slightly warm to avoid high exothermic reaction, which can cause thermal burns. This direction will be from an experienced medical provider. Submerge the plaster until bubbles cease. Squeeze out excess water by folding in the hands in an accordion-style fashion. Wring out excess water using the thumb and fingers. This laminates the plasters for more strength. Lay it on the extremity and use your hands to contour the extremity. Add more padding if desired to allow for easier removal later. To avoid the plaster from sticking to the elastic bandage and to avoid curing or solidifying together, add the stirrup. Pull the stockinette over the plaster splint ends. Open the end toward the foot by cutting excess padding around the toes. The goal is to display and visualize the first and fifth digits. Quickly apply the elastic bandage to allow more time for proper positioning. Use an assistant if the patient cannot keep their legs still and in place. Use the widest bandage possible to apply coverage more quickly. Ensure you can visualize all 5 digits, the foot is not inverted or everted, and the patient is in a neutral or 90-degree angle. Hand placement is mid-lateral to avoid inverting the foot. Avoid finger indentions by using your fingers to hold the extremity. Use the palm of your hand. Question the patient, if conscious, if the splint is squeezing on the sides of their toes, or if they feel pain like something's poking the sides of their ankle since the application procedure. Hold the patient's position until it is set and holds its shape, and rest the extremity on a non-plastic surface to avoid more thermal heat buildup. What I'm showing you here is the bandage did not stick to the posterior splint and allows for easier removal for emergency situations. This is the posterior splint with a stirrup. Thank you.